And what is important in this case is that we need to remember that we started to talk about the muscles of the upper limb, and we've talked about the muscles uh, of the shoulder region, as well as we've talked about the muscular structures of the arm region itself. So, and we do have the rest of the parts that is left for us for today and for tomorrow. These are particularly the part of the muscles of the forearm and the muscles of the hand. So, to be honest, to compare the part of muscles of the forearm to the muscles of the arm, for example, yes, they are much more extensive type of the structures. There are a much more amount of the muscles. Although here comes the idea: how can we let's like that classify or group this particular muscles in the region of the forearm? So first of all, what do we remember is that in the case of the muscles of a shoulder, their main function was the movement of the arm, particularly at the shoulder joint, yes, particularly at the glenohumeral joint, as well as the smaller muscles were simply stabilizing the portion of the scapula, as well as the part of the clavicle, or fixing them in the normal position in the case of the movement of the arm in the glenohumeral joint, yes. Okay, in the case of the arm muscle, so as a result, according to the subdivision, we were dividing them into the anterior and posterior compartments, where, sorry, where these two compartments were antagonistic to each other, meaning that they were performing the movements which were opposing type of the movements, yes. So if it would be the flexion, most commonly it was the flexion, for example, in a case of the anterior compartment. In the case of posterior compartment, we had the movement which we call extension, yes, as you remember. Or if it was abduction, then it would be adduction as the opposing or antagonistic type of movement. So now what is happening in the case of the arm? The arm and muscles of the arm mainly were performing the movement of the forearm in the how do we call it? Oh my God. In the elbow joint, yes. So as a result, there we also made the subdivision, and this subdivision was according again to the anterior and posterior regions. So simply we said that we have the anterior and posterior compartments, and we even said that particularly the portion of the anterior compartment is mainly producing the flexion. That's why the function was the flexion. And in the case of the posterior compartment, we had the movement which was opposing, and this movement was particularly associated with the extension, yes. So now when we continue with the part of the forearm, to be honest, logically and logic which we had in the case of the atrioappendicular muscles or the muscles of the arm is not that much changing, you know. We again have the two main type of the compartments which are subdivided, and you can see them particularly, oh, sorry. Let me show you the picture what I'm talking about. Yeah, here it is. For example, in the picture D, I like this picture because it is showing very precisely the subdivision of the muscles of the forearm in two main compartments. And again, these are anterior compartment and the posterior compartment, yes? So according to the anatomical position of the body, yeah, anterior compartment is the one which we have on the anterior surface, yeah, in this case. And posterior one will be the part of the posterior which is localized on the posterior surface. As a result, according to the joints which these muscles are simply crossing, this will be the part of the joints of the wrist region, as well as the metacarpophalangeal type of the joints, as well as the part of the phalangeal type of the joints, okay? As a result, when we talk about the movement in a case of the forearm region, Okay, in this case, we can simply say that again, in the anterior compartment, we will have the flexion type of the movement. In the case of posterior compartment, we again will have the extension type of the movement. As a result, most of the muscles here will contain in their name the word flexor or extensor, showing us particularly what type of the movement is performed. Okay, now what is subdividing these two particular compartments, which is very well seen in this picture? Look in the picture D. And this is particularly the part of the bony structure, as it was, for example, in the case of the arm, where we had the humerus only. But in the case of forearm, we remember that we do have two main type of the bones, which are radius and the ulna. Ulna is more medially localized, radius is more laterally localized, and in between of them, we do have the connective tissue layer, which we call the interosseous membrane, as you remember. So as a result, these three structures will be dividing the anterior compartment, which you see here in the bluish color, from the posterior compartment, which you see here in the brownish color. So, and the names of the compartments will be flexor and extensor. Although at the region of the forearm, we have one more specific type of the movement, which is the supination and pronation. Do you remember? So because of itself, the radius, which whose head is simply literally how to say the concave type, and on which we have the portion of the capitulum of the humerus residing. In this case, we do have some rotatory type of the movements. And why? Because of simply the part of the joint itself, yes, here in between. And as a result, we do have the part sorry. Okay, let me first explain some part, and then I will come to the all of the questions which you will be interested in. Okay, so the idea here is that what you see is that the part of the compartments will be subdivided as the flexor pronator compartment, that will be the anterior compartment in this case, and the extensor supinator type of the compartment, which you see here in the brown color. So as a result, anterior compartment makes the flexion and the pronation, the posterior compartment makes the extension and the supination. Okay. Well, as a result, let's see what are the muscles here, and let's see what is associated, let's like that, with this particular movements. Yes, so what you see in these pictures, first of all, in the picture A and B, you can see particularly bony structures in the A. In the B, you can see the bony structures as well as the portion of the interosseous membrane and its blood supply, which sure is not interesting for me in this particular semester. And what you see in the case of the picture C here, which is mainly showing you the anterior surface, you can see that we do have a part of the muscular structures. So here we do have a portion of the anterior muscular compartment structures, and as a result, you can see that most of their tendons are simply overlying or passing or crossing the part of the how do we call it? The part of the wrist joint, as well as even the part of the metacarpophalangeal joints, as well as the portion of the phalangeal joints. Okay. As a result, the part of the muscles of the forearm will give us the extension and as well as the flexion of not only the hand in the wrist joint, but also the digits in the metacarpophalangeal joints as well as in the interphalangeal joints. Now, what you see particularly here is that these are the different cross sections at the different levels, and here what you see, this is the level of the cross section at the cubital fossa, particularly the one which is in the anterior compartment, in the anatomical position is seen anteriorly to the elbow joint, okay, where we do have the region of the humerus. As you can see, it's not yet even the part of the radius and the ulna. And here particularly you see the part of the muscles, which are mainly the muscles of the arm. As you can see here, the part of the brachialis here, for example, as well as the part of the portion of the biceps brachii muscle. But here at the level of the humerus, you can already see the type of the muscles, which are flexors and the extensors of the forearm muscles. This information, this particular picture already gives us the important sign that the attachment of the flexors and the extensors, yes, are associated not only with the radius and the ulna, but also with a part of the humerus. We will come back to that. We'll come back to that portion. Coming towards the B region, that's what you can see here. You can see that here we have the cross section at the proximal part of the forearm. And here now you can see the subdivision according to the compartments. So you do have the flexor pronator or anterior compartment, as you can see, and that's the truth. You see here the part of the radius. Here you see the portion of the how do we call it, interosseous membrane, and here we do have a part of the ulna. And as a result, these three structures are literally subdividing the anterior compartment from the portion of the posterior compartment. Okay, now what is important also in this region is that according to even like in this picture, they show you the different the muscles in the different colors. Why we do that? This is sure schematical representation, purely sure schematical representation. Why? Because we need to know that in the case of both the flexor pronator and the extensor supinator type, or anterior and posterior type of the compartments, we do have the layers of the muscles, which are subdivided according to their localization to the superficial structures, to the skin simply. As a result, what you see here, particularly in the case of the anterior compartment, you can see the more darker colored muscles, which are representing the superficial type of the superficial layer of the anterior compartment muscles. Here you can see the part of the intermediate, and here we do have a portion of the deep type of the structures or muscles of the anterior compartment. In the case of posterior compartment, we do have the only two layers, and these are the superficial and the deep layers of the muscles, okay, which we'll talk right now about. Continuing to the next portion, what we see here in the picture C, and we saw this picture C, if you remember, when we're talking about the joints of the upper limb, I showed you how it looks like the part of the flexor retinaculum, particularly because it wasn't clear how it looks like on the cross section. So you can see here, particularly the part of the cross section through the distal row of the carpal bones, as you can see. And as a result, you can see all of the tendons, okay, of the anterior and posterior compartments. Particularly in this case, we have mainly the part of the anterior compartment, because all of them are the part of the flexors, as well as you can see here the flexor retinaculum, meaning that flexor retinaculum itself means that it's the, if you remember, I told you this is the tendon, which is, sorry, this is the ligament, which is transverse type of a ligament. That's why we also call it transverse carpal ligament. It's like the band or like a bracelet surrounds anteriorly in the anatomical position the region of the wrist. An important thing what it does is that it is, let's say, like that, reinforcing and making the tendons of the muscles of the forearm to be localized in the anterior and the posterior regions, you see, because if you remember, on the posterior side we do have the same type of a ligament, which we call extensor retinaculum. So, and as a result, on both of the sides, like a band which is surrounding the whole wrist, we do have this ligament to reinforce the part of the tendons of the muscles of the forearm. So as a result, let's go through the muscles of the forearm. And one of the most interesting thing is that when we talk about the muscles of the forearm, many of them, as you saw, they are not only crossing the part of the wrist joint, but they are also, most of them, like up to 17 of these muscles, are passing and crossing the part of the elbow joint. And as you can see, particularly here, you see that here we do have the prominent medial epicondyle of the humerus, and you can see how large amount of the muscles which are attached to that region. So now the most interesting part is that, okay, we said that most of the muscles of the forearm are also crossing the elbow joint. It's already logically means that the attachment of that muscles should be on the humerus, yes, particularly its distal part. And here comes, in case of, and right now we are talking about the anterior compartment, please. Here you can see this is the anterior view in the anatomical position. And here we do have a distal humerus, which contains, as you remember, two epicondyles. One is the medial epicondyle and one is the lateral epicondyle. So please remember that these epicondyles, they are producing or comprising simply the place or the point of the attachment of the both the flexors and the extensors. The medial epicondyle, that's what we call, as you can see from here, the common flexor origin. Okay, so flexor common origin is the surface of the medial epicondyle, where most of the anterior, why common flexor origin? You already understand, if it's flexor, it means that anterior compartment muscles, yes, will be attached to the medial epicondyle. Okay, so as a result, you can see here common flexor tendon with the structure which is attaching most of the muscles to the medial epicondyle. Okay, the same type of a structure we have on the opposite side, on the lateral epicondyle, and that's what we call common extensor origin. Common extensor origin means that we are having the attachment of most of the posterior compartment muscles to the lateral epicondyle. Till now, is it clear or not? So it's clear. Okay, now the next portion is that what are the anterior compartment muscles, or simply we call them, these are these are flexor pronator type of the compartment, yes, in this case. So as a result, what we see particularly here is that as I said, we have the subdivision according to the layers. So we do have the superficial or first layer, superficial or first layer, which you see in the picture B. Here in the picture C, you see the part of the intermediate layer, or simply the second layer of the anterior compartment. And in the case of the D, you can see the part of the third layer or the deep layer of the muscles, as well as the picture E shows us one muscle which is also associated to the deep layer, although it is very much distally localized and covered by the tendons of the other muscles of the deep layer. As a result, it is not seen here very well, but they just put it separately to see how it looks like. So let's start with the very first layer particularly, and this is mainly represented by the muscles, which we call, as you can see here, the pronator teres. This is the part of a superficial layer, as well as I told you, most of the muscles will contain in their names the word flexor, yes, or extensor in the case of posterior compartment. As a result, we have flexor carpi radialis, I do believe it's clear why we call it like that. Yes. So the muscle is the one which is flexing the, which is performing the flexion. Flexion of what? Of the carpal region, so the wrist, and but from the side of the radius, as you can see, more laterally localized. That's why you can see the abbreviation of FCR stands for flexor carpi radialis. On the other side, on the medial side, we will have again the flexor, because it's again the anterior compartment. But in this case, we do have flexor carpi ulnaris muscle. So I do believe it's clear why we call it like that, and the abbreviation will be accordingly the FCU. So as a result, out of 4 muscles which are represented in the superficial layer, you can see that 2 of them contain the name in their name, the word flexor, and the one contains the name in their name, the word pronator, meaning that that's why we call the anterior compartment the flexor pronator compartment. Yes. So pronator teres, flexor carpi radialis, and the flexor carpi ulnaris, as well as one of the structures what we have here. This is the palmaris longus muscle. Now, what should be the function in this case? According to that picture, you can see that all of these muscles mainly, sure, except for the pronator teres, are crossing the part of the wrist joint, and that's for sure, and makes the attachment, I mean the distal attachment, to the regions of the metacarpals, as you can see, as well as the portion of the carpals. So expectation in the layer, in the superficial layer, expectation of action of these muscles should be, sure, the flexion, and I do believe it's clear very much, yes, should be the flexion, but flexion of what? Of the wrist joint. Why wrist? Why I'm saying about that? Because you remember that when we said about the anterior compartment, we said, yes, there are several layers, yeah? And as a result, because of the presence of several layers there, we see that their attachments are different in the distal region. Yeah, so you can see that in the case of the first layer, it is mainly closer to the part of the wrist joint, and as a result, the only joint that they will be distally crossing, this will be the wrist joint, and as a result, we'll have the flexion of the wrist in this case, yeah, or flexion of the hand at the wrist joint, simply to say. Okay. In the case of the intermediate compartment, as you can see, which is composed of the flexor digitorum superficialis, you can see. So the name again shows you that we are talking about the flexor type of muscles. Digitorum, it gives you the idea that it will be flexing the part of the digits. Yeah. To be honest, we do have 2 types of the flexor digitorum. One is the superficialis, which is the only type of the muscle producing the or constituting the part of the intermediate layer. But in the case of the second one, we have the flexor digitorum profundus. From the name, I do believe it's clear. Superficialis is more superficially localized. Profunda literally means deep structure. So flexor digitorum profundus, as you can see particularly here, in both of these cases, they are helping us to flex the phalanges. Yes, so to flex the digits at the part of the metacarpophalangeal joints, as well as the interphalangeal metacarpophalangeal joints, as well as the interphalangeal joints. Okay, so as a result, both of these muscles will be doing it together. Just the part of the profundus is a little bit slow, and as a result, we need the help with the flexor digitorum superficialis to perform the strong type of the flexion. The parts of the deep or a third layer, in this case, okay, we said about the flexor digitorum profundus, but the digits, what we are talking about in case of a second and a third layer, were particularly the lateral most, in the anatomical position, it will be the medial most ones. These are the index fingers, so starting from the second digit, and also the parts of the, including the 5th digit. Okay, but the part of the pollux, which is representing the thumb, simply, which is the most lateral in this case. As you can see, in the case of the deep layers, it contains one separate muscle, which we call flexor, but not digitorum. It's flexor pollicis, because it comes from the word pollux, which simply means the thumb. So flexor pollicis longus, as you can see, which covers all of the part of the metacarpal, as well as the both of the phalanges of the thumb. And as a result, this structure, this muscle, contains a long tendon, and as a result, we call it flexor pollicis longus. Now let's go through every and each of these muscles, and let's see what are they doing and what are they performing and what are their proximal and distal attachments, or simply the origin and the insertion. Again, coming back to the picture A, you can see, according to this key portion, you can see that we have the in the orange color, the part of the proximal attachments, and in the case of the bluish color, we do have the distal attachments of the muscles. Yes, so let's start with the very first muscle of the first layer of the anterior compartment, and this is particularly the pronator teres muscle. So what do we have in the case of the pronator teres muscle? First of all, interesting thing that it has two types of the attachment, or two parts of the attachment. One is already clear. This is the common flexor tendon, which is attached to the common flexor origin or medial epicondyle of the humerus, as you can see particularly here. Yes? But the other one, so that's why we say that it has the humeral head according to its attachment, as well as we do have particularly the ulna head in this case. And the ulna head, as you can see here, is very much associated with the coronoid process of the ulna. Okay, so as a result, the pronator teres has 2 points for the proximal attachment. So with the part of the humeral head, it is the medial epicondyle with the portion of the common flexor origin. And in the case of the ulna one, we do have anteriorly the portion of the coronoid process, which is also giving rise to the proximal attachment of the pronator teres. As you can see, according to this picture, the part of the distal attachment is simply coming on the part of the forearm itself. Because if all of the others, and I said that, if all of the others have their tendons very long towards the part of the carpus and the hand itself, you can see that they are all crossing the wrist joint, as well as the other types of the joints in the hands. In the case of the pronators, the pronator type of a muscle, such as pronator teres, and you will see the same in the case of pronator quadratus, which you see in the deep layer. Yes, they are not crossing the wrist joint because their main function is to make the pronation rather than flexion or extension. Yes, and as a result, the part of the distal attachment in the case of this radius particularly, you can see that this is somewhere in the middle of the radius. Particularly, we call it simple. You remember, in the case of the radius, we said that it is in the middle a little bit convex. Yes, it is protruding to the lateral side, and as a result, we say that the middle part of the convexity of the radius particularly will be the point of the distal attachment or insertion of the pronator teres muscle. Okay, as a result, its main function in this case would be the pronation. So, but also it helps in the flexion. Why flexion and where flexion? Because we said that one of the head, which is the humeral head, was attached to the common flexor origin. Yes, and as a result, it is crossing the elbow joint. So as a result, the action in this case will be one thing, the pronation of the forearm, but the second thing, this will be the flexion of the forearm at the elbow joint. You see? So here particularly. All right? So as a result, pronator teres helps us to do that. Now, the part of the flexor carpi radialis as well as the palmaris longus, as well as the flexor carpi ulnaris will have again and again the same origin as the humeral head of the pronator teres, meaning that it will have the same type of the proximal attachment on the medial epicondyle of the humerus, as you can see here. So at the level again and again of the common flexor origin. Although there is always some small exceptions from the rule. And this is the flexor carpi ulnaris, this FCU, abbreviated as FCU. Why? Because this particular muscle has two types of the heads, as it was in the case of the pronator teres. So here we do have the humeral head, and again, it's the medial, the attachment here is the medial epicondyle of the humerus. And the second one, what we have here, this is particularly the ulna head. But in the case of the ulna head, you can see here how it looks like, where it is. Although it's not seen on this side, because why? It is surrounding the part of the ulna and makes the attachment to the posterior border and the surface of the ulna, as well as the part of the olecranon. You see? And as a result here, if you remember, we had here the portion of the aponeurosis of the biceps tendon, yeah? So particularly it will be blended. I mean, this region, the part of the ulna head of the flexor carpi ulnaris will be blended into this particular aponeurotic tendon of the biceps brachii, okay? So what is also interesting here for us is that particularly in the portion of the first layer or superficial layer of the muscles of the forearm, you can see that except for the pronator teres, when we talk about their distal attachment, it is mainly associated, as you can see here, with a part of the either metacarpals, yes, or the portion of the carpals. And as a result, what is interesting that if we talk about the flexor carpi radialis, which is more laterally localized, as you can see, it is crossing the region of the wrist and makes its attachment to the lateralmost metacarpal, sure, not the thumb, but this is the second metacarpal, particularly at its base. So simply to say, the base of a second metacarpal is the most common attachment or distal attachment or the insertion of the flexor carpi radialis muscle, or FCR, simply to say, yes? At the same time, we do have on the other side, on the more medial side, we have the flexor carpi ulnaris muscle. And the flexor carpi ulnaris muscle, as you can see, it passes also towards the wrist joint. And here it is also making the attachment or distal attachment or insertion into the metacarpal bone, and particularly this is the fifth metacarpal bone here because it's more medially localized, as well as the carpal bones such as the hook of the hamate, as well as the part of the pisiform. So as a result, these 3 points for the attachment, for the distal attachment, are literally the representing the attachment of the flexor carpi ulnaris, or FCU by its abbreviation. In between of these two muscles, we do have the palmaris longus muscle. Do you see? So in the middle of these two, we have the palmaris longus muscle. Attachment is, I do believe, clear for the proximal part, but in the case of a distal one, you can see that it is also passing or crossing the part of the wrist joint, and here it will start to blend into the portion of the flexor retinaculum, as well as have the attachment to, like a broad attachment, the aponeurotic attachment to the part of the metacarpals of the upper limb. You see, and mainly sure in this case we are talking about the part of the medial metacarpals. So these are from the starting from the second, including the fifth metacarpal in this case. Okay. So as the result, what we see in the superficial layer, or simply the first layer of the anterior compartment muscles, we can see that they are the ones which are having the common origin from the medial epicondyle with some additional structures, as well as we do have the attachments which are also very close to each other at the region of the metacarpals. Yes. Now the question will be, okay, if it's a superficial layer, it's clear that it should be performing the flexion. Yes. But what will be exact type of the actions in the case of superficial layer? And here comes the idea that if we talk about the pronator teres, yes, so okay, it has the pronation and also it has the flexion, but of the forearm in the elbow joint. All of the others, according to their tendons, you can see how they are passing the wrist joint. All of them will be making the flexion of the hand at the wrist joint. Yes. But important thing that when we talk about the flexor carpi radialis and the flexor carpi ulnaris, their attachment is most lateral and the most medial respectively. As a result, a contraction of the flexor carpi radialis will be contributing also in the abduction of the hand at the wrist joint. Yes? In the case of FCU, which is the flexor carpi ulnaris, it will perform, besides of the flexion, it will perform the adduction of the hand at the wrist joint. You see? So as a result, the superficial layer, besides of making simply the pronation and the flexion, as we said, it will also assist in the abduction on the lateral side and the adduction of the hand at the wrist joint at more medial side. Okay? Till now, was it clear or not?
No, ma'am. The last one is not clear.
Which part was not clear, Tarun? Please, can you tell me that I could explain again?
It's, ma'am, that you explained in the last.
Okay, the part of abduction and adduction, you mean, Tarun?
Yeah, ma'am.
Okay, let me explain it again. So, as these structures, as you can see particularly here, are localized, yes, in the anterior compartment. But what is also important that the part of the FCR, which stands for the flexor carpi radialis, and the FCU, which stands for the flexor carpi ulnaris, yes, they are more laterally and medially localized, yes, in the superficial layer. And according to their attachment, you saw that the attachment comes not to all of the metacarpals simultaneously, but in the case of the radialis, it was simply the second metacarpal. In the case of the ulnar ulnaris, it was the fifth metacarpal, as well as the part of the pisiform and the hamate. So more medial type of the structures. So what is important in this case is that if we have the contraction of the radialis or the ulnaris, sure, it will be contributing in the flexion of the hand in the wrist joint. But also because of their localization and the attachment, you can see that these flexor carpi radialis, because it's more laterally localized, it can make the abduction, you remember, abduction of the hand at the wrist joint. Yes, because it was the lateral movement, the abduction of the hand at the wrist joint. In the case of the ulnaris, it will help to make the opposite type of a movement. Why? Because of its, again, localization and attachment, which is more medial. And as a result here, it will help us to make the, or contribute into the adduction of the hand at the wrist joint. Is it clear now, Tarun?
Yeah, ma'am, it's clear now.
Good.
Thank you.
So you're welcome. So we can, I do believe, continue with the next portion of the muscles. And here, this is the picture C, which shows us the second layer, yeah? The second layer of the muscles is simply composed of one broad type of the muscle, which we call flexor digitorum superficialis, yes? So from the name, it's even clear, I do believe, what it will be doing. So, but let's go through, first of all, the proximal and distal attachments. As I said, important thing, it is very a broad type of the structure. By its particular proximal attachment, it is seen that here we can subdivide it into two parts. We can say about the humeral-ulnar type of the head, so where we have the medial epicondyle of the humerus. So again, this common flexor origin as the attachment of that muscle, as you can see here, as well as, because it's not the simply humeral type of the head, it's a humeral-ulnar type of the head, we can see the part of the coronoid process, yes, of the ulna, and it's also will be the attachment for the humeral-ulnar head. Then you can see that as it is passing, it's still the having the attachment to the radius. That's why in the flexor digitorum superficialis we can identify the part of the humeral-ulnar head as well as the radial head. And as you can see here, it is simply attached, as it is the anterior muscle of the anterior compartment. It is simply attached to the anterior surface of the proximal part of the radius, as you can see here. Okay, so as a result, on the proximal attachment, we have two subdivisions of the flexor digitorum superficialis, or the abbreviation here is FDS, as you can see. So this is the humeral-ulnar head and the radial head. Now, in the case of its distal attachment, again, as it was in the part of the first layer, we had the cross of the carpal region, but we do not call it flexor carpi something, yes? We call it flexor digitorum superficialis. It means that normally it should be also passing not only the wrist joints, yes, but also metacarpophalangeal joints, and even here you can see that it is passing the portion of the interphalangeal joints. You see why? Because its distal attachment comes on the shafts of the phalanges, which are localized in the middle. So middle phalanges are the ones which are making the attachment or providing the attachment to the flexor digitorum superficialis muscle. You see how it looks like. So as a result, we have here the part of the attachment, and what is important for us is that the action which this particular muscle will be performing. So although sure, we have the how do we call it, expectation that it will be flexing the part of the carpus, but you see that the tendons are crossing more smaller type of the joints, and as a result, mainly here we can say that we will have the flexion of the digits, particularly 4 medial type of the digits, starting from the second one, including the fifth one, at their part of the interphalangeal joints, particularly the proximal interphalangeal joints. You will ask, why proximal interphalangeal joints, and what does it mean? So you remember we had the proximal phalanges, we had the medial phalanges, and we had the distal phalanges, yes, between which we have 2 types of the interphalangeal joints. Between the proximal and the medial, we have the proximal interphalangeal joints, and between the medial and the distal one, we have the distal interphalangeal joints. As the result, because the attachment comes on the middle one, the joints which will be here, the flexion which will be seen will be seen at the proximal interphalangeal joints. Okay. In case if we do have a complete and then very strong contraction of the flexor digitorum superficialis, then we will have more flexion of the interphalangeal joints as well as the flexion of the digits at the metacarpophalangeal joints, so between the metacarpals and the proximal phalanges. Is it clear till now? Guys, is it clear? I do believe it's all clear, yeah? So, Okay, let's finish with the part of the deep layer, and then let's have some rest, okay? Because I need to have a rest for my throat. Okay, so in the part of the D picture, you do have a third layer, and as well as in the E picture, you have a third layer or deep layer of the muscles of the anterior compartment, where again, two of them are representing the flexors again and again. And again, we have the flexor digitorum, and also we do have the flexor pollicis type of the muscle. In case of the distal most region, we have the formation or presentation of the pronator quadratus muscle. Now, flexor digitorum profundus. Again and again, it's the deep layer. That's why profundus. And I do believe it's clear that again we talk about the flexion of the digits. Yes, but what do we see in this case? As more deep are the structures, as more distal their insertions are. Yes, as a result, in the case of flexor digitorum profundus, we have two parts. We can subdivide it into two parts according to its distal attachment. In a case of proximal attachment, everything is the same here. Again, we are talking about because it's more medially localized. As you can see, it is associated with the anterior surface of the interosseous membrane, and more medially, it is coming to the part of the medial and anterior surface of the ulna, as you can see here. Okay, so these two structures will be the proximal, will produce the proximal attachment for the flexor digitorum profundus muscle. Although as it passes through the part of the wrist joint and crosses it and enters towards the metacarpal region as well as the phalangeal region, you can see that we can subdivide it into the medial part. This is the medial part in the anatomical position. So meaning that according to its distal attachment, the medial part of the flexor digitorum profundus will be attached to the distal most structures, and these are the basis of the distal phalanges of the digits 4th and 5th. So the medial most, yeah? In the case of a lateral part of the flexor digitorum profundus, you see again that the tendons are very long and they are passing towards the part of the distal phalanges again, but of the more laterally localized digits, which are 2nd and the 3rd digit. Okay, as a result, these two parts here, they will be producing two separate type of the actions. So they will be flexing, that's for sure, the digits at the distal interphalangeal joints. Okay, but in the case of the lateral part of the flexor digitorum profundus, they will be doing it at the 2nd and the 3rd digit. In the case of the medial part of the flexor digitorum profundus, they will perform it at the 4th and the 5th digit. Okay, so again and again, as it was in the case of the flexor digitorum superficialis, in the flexor digitorum profundus will also give us the flexion of the digits, but in this case, so in the case of the superficialis, it was the proximal interphalangeal joints. In the case of the digitorum profundus, we do have the distal interphalangeal joint flexion. Okay, so what is also interesting for us, just let's like that generally to say in this particular two structures. So when we talk about the flexors themselves, yeah, so this will be the flexor digitorum superficialis, or it will be the flexor digitorum profundus. They together sure help in the flexion of the wrist joint as well as in the part of the metacarpophalangeal joints. Sure they do, okay? But main action for them is the flexion of the digits in the interphalangeal joints. An interesting thing that when we talk about the flexor digitorum profundus, which you see here, yes, it is, as I said, it is flexing the fingers very slowly, okay? And that's why we need the flexor digitorum superficialis, which is much more strong in this case, or much stronger, and as a result it helps to make much faster type of the flexion of the digits. Okay, so interesting thing is that when we do have the flexion of the hand at the wrist joint, yes, most commonly we have also physiologically the contraction of the flexor digitorum profundus and the superficialis, and as a result we do have the flexion of the metacarpophalangeal joints as well as the interphalangeal joints, you know. So as a result, when we do, like when we are trying to perform the part of the flexion, yes, when in the case of the part of the opposition of the thumb to the other type of the finger, of the digits, you can see that this movement when we hold something, yes, it is very much reinforced by the flexion of the carpal joint, as well as we do have the part of the metacarpal joints as well as the interphalangeal joints. All of them are flexed. As a result, we have this strong type of the movement when we can hold the subject in the hand. Okay, and the last part out of the deep structures here, or deep layer or third layer of the anterior compartment, what you see, these are particularly the parts of the flexor pollicis longus, and I do believe it's clear why we call it like that, why flexor pollicis longus. Yes, I told you already, because it is associated with the pollux, and the pollux is the thumb simply of the hand, and as a result here you see that the proximal attachment is mainly associated, because it is more laterally localized in the third layer. So if the flexor digitorum profundus was associated with the interosseous membrane and the ulna, more laterally localized flexor pollicis longus will be associated with the anterior surface of the radius, as you can see here, as well as here particularly, that's how it looks like. And sure, the portion of the interosseous membrane, which is adjacent to the part of the radius. Yes, so this will be our proximal attachment for the flexor pollicis longus. In the case of its distal attachment, what you see here particularly, you do have, again, as it was in the digitorum profundus and superficialis, the attachment was to the phalanges of the digits. Yes, so in the case of flexor pollicis longus, it is also attached to the phalanx, particularly this is the distal phalanx. And distal, it is that's why we do have a long type of a tendon. That's why we call this type of the structure or muscle flexor digitorum longus. Now the question is, again and again, what is the action? And as it was in the flexor digitorum superficialis or profundus, we had the flexion, yes, of the digits. Here we also have the flexion of the first digit of the thumb, particularly in the portion of the interphalangeal joints. Okay, so as a result, you can see that we have literally three types of the flexors, which are mainly giving us the flexion of the digits at the interphalangeal joints as well as the metacarpophalangeal joints. Okay, and the last thing what is seen in the case of the deep layer or a third layer, this is particularly pronator quadratus. So, and it's like, not imagine, just simply to recall this information easily, you can see that pronator teres is more proximally localized. The part of the pronator quadratus is more distally localized. And from the name quadratus, it literally looks like the rectangle. Yes, you see that its proximal and the distal attachments will be approximately in the same plane. As a result, in the case of the proximal attachment, this is the distal part, the distalmost part of the ulna, particularly its anterior surface because it's anterior compartment. And in the case of its insertion or distal attachment, it will be again the distal part, but of the radius now, as you can see here. And again, it will be sure the anterior surface. You see? So as a result, in the part of the pronator teres, as a result, the pronator quadratus is helping to the pronator teres to perform the pronation of the forearm. Okay. Is this part clear till now? Everything? Okay, guys, then let's have 10 to 12 minutes rest, okay? And I will be back to you. All right.